Right. As I was just saying, this is an interactive presentation, and I can tell that you're already a great audience and you're going to participate. So that's wonderful. It makes me think of being in the theater where you have a really, really good audience and you can tell. So we are going to just dive in. Before we do that, though, I want to thank everyone again for being here, and I want us to all commit to being present together. I know that Zoom presentations are not always as fun and engaging as in-person presentations, but I think we're going to change that. So if you can, please try to minimize distractions. So minimize other windows, put away other devices. And because this is a longer presentation and probably most of us are going to be sitting for a while, although if you do need to get up and move around, please do that. I'm going to start us off with a short centering practice. Okay, so this comes from presence-based coaching, which is something that I learned about from a friend of mine when I did career coaching with her. The idea is that we use our 3 dimensions in terms of how we are in space to connect to our bodies. And if it's available to you in your space and in your body, I invite you to stand up for this practice unless there's a reason you prefer to sit. So I'm going to stand up and I'm going to give you a moment to stand as well. And I'm going to lift my desk up. Okay. Hopefully everyone else is ready too. Feel yourself taking up the space that you need. Notice the feeling of the soles of your feet on the floor. Allow yourself to become heavy from the waist down, and allow yourself to straighten up from the waist up. If you notice that you're holding any tension in your neck, your shoulders, your jaw, your forehead, or elsewhere, gently release it. Observe your sense of connection to the ground and know that the ground beneath you and the earth offer you support and can help you feel centered. Bring your attention up from your feet to your legs, to your spine, all the way up to the top of your head. Allow yourself to take up your full length, your full dimension of dignity. Notice that you are here in your full length. Observe how you carry yourself with dignity. As you notice how your sense of dignity feels in your body, bring your attention to the dimension of your width. Allow yourself to take up your full space, your full width, representing belonging. Tune in to that sense of belonging, to this community that we're creating together today, to this world, to this sense of place, your belonging. With your dignity and your belonging, turn your attention now to your sense of depth, forward and back. You have your big dinosaur tail, representing everything you've learned, all of your hard-earned wisdom and knowledge. Consider where you've come from, that sense of your own fundamental sufficiency, that you have everything you need. If you need to, you can imagine leaning back on your dinosaur tail as another source of support. Connect with that kind of strength, that fundamental sufficiency, that enoughness. Looking forward, think about what's yet to come, that sense of potential, the things that may happen in the future. Notice how in this centered, grounded place, you're standing between what's behind you and what's yet to come. You have choice here. Take a breath and breathe into all 3 of those dimensions today in preparation for this workshop and for being together. Remember what's important to you and why you're here. Think about the commitment you're making to yourself today and what you're hoping to gain. When you're ready, you can have a seat and we'll begin. I'm going to give everybody a moment to sit back down, and I'm going to sit back down as well. Okay, great. Oh, I see we have even more people joining us. That is very exciting. Okay, I'm not going to read you my whole bio, but I did want to let you know a little bit about me and about where I'm coming from. I am a licensed clinical social worker, and I've trained in a variety of different evidence-based practices, mainly cognitive behavioral therapies, but other therapies as well. I listed a few of them here: TFCBT, prolonged exposure therapy, CBT for insomnia, cognitive processing therapy. I've worked in a lot of different settings, which is something that you'll hear more about later. And I currently work for a group private practice, but I am very excited to share that I am starting my own solo practice. And I've been able to bring lots of different work experiences to the work that I'm doing in private practice as well. I use a strengths-based and holistic approach to therapy and try to consider health, mindfulness, resilience, and the systems around us. Okay. Um, because I've had a lot of different jobs, I've also had a lot of different experiences with supervision. As a supervisee, I've worked with 14 different supervisors, mainly social workers and psychologists, as well as counselors and marriage and family therapists too. I've worked in home and school and community settings, mainly as a therapist, but as a case manager also. And throughout my career, I've had lots of different supervisory experiences across the whole spectrum from great to neutral to problematic. As a supervisor, I completed the seminar in field instruction or SIFI course. That was when I was first training to supervise social work students. And I supervised social work students and a psychology postdoctoral fellow at one of my previous jobs. So I've supervised a few different people in the field. And I also have experience with interviewing and hiring. Before I get to the overview, I imagine that this is something that you already know from signing up, but we are going to have a break halfway through-ish today. So we'll have a 10-minute break later. So if you do need to do anything to take care of yourself today, whether that's going to the bathroom or getting a drink of water or something like that, please do. We will also have a break. So here's where we're going today. We're going to take a look at the developmental stages that we go through as behavioral health professionals. We're going to spend some time on supervision versus consultation, understanding the similarities and the differences. I have a short synopsis about the codes of ethics across disciplines. We're going to talk about the purpose and function of supervision. Why do we have it? What's it for? We'll talk about effective, ineffective, and even harmful supervision. We are going to take a close look at one of my favorite articles about supervision, which presents supervision through the lens of attachment. I hope you like it as much as I do, but you might not be so nerdy to be that excited about an article on supervision, which is also okay. We're going to talk about trauma and burnout. We're going to talk about healthy and unhealthy workplaces, what that looks like. And that's going to vary based on your circumstances, but there will be some generalities as well. We're going to talk about systemic considerations at work. We'll talk about challenges in supervision, addressing ethical dilemmas. I have some real life experiences that I'm going to share, as well as a situation that's more of a composite. And we're going to talk about making work better. The key things that I want you to take away from today are that ethical issues are complicated and can show up in a lot of different scenarios. So it's always really important to consult and ask for help when we need it. Systemic problems at work aren't your fault, but dealing with the repercussions of them may be your responsibility. So please take the time to be informed. And also learning to advocate for yourself effectively will support your professional development. So it's a skill that I really recommend everybody build. Okay, before the introduction, I'm just going to check in the chat and see if there's anything going on, because a lot of people have commented and it looks like some new people have joined as well. So I wanted to make sure I didn't miss any questions. Okay, great. So we have some greetings from different states. Bonnie talking about the format.
So we just have everyone checking in here, and I can monitor the chat for any questions that come up. If anyone is needing any support or has questions on the CE, about attendance, anything like that, please reach out to me, whether it be an individual message or here in the chat, and I'll be monitoring that for
Okay,
y'all.
Dawn says speak up or move the mic closer if you can. Dawn, is this better? Or Jane, is this better? Can somebody, okay. Thank you so much, everybody. I appreciate it. I am naturally pretty quiet, so sometimes I do need to be told to be louder, which is not a problem that everyone has. Thank you very much. This is why I checked in early because I wanted to make sure not to miss anything important, which is we can't hear you, Mattia, be louder. Great. All right. So that's where we're going, and this is our introduction section. Let me see what's going on in my, oh, here. Okay. First, Zoom poll. Hopefully these are going to show up one at a time. Bonnie was kind enough to get everything set up. So if you could share which of these apply to you, that would be great. Are you a student? Are you a new grad? Are you licensed at the associate level, like a licensed associate professional counselor, licensed associate marriage and family therapist, licensed social worker, psychology postdoctoral fellow? Are you independently licensed? So an LPC, LMFT, LCSW, licensed clinical psychologist? Are you a supervisor? Are you a business owner? There are a lot of you, so I'm going to give everybody just a moment to respond to this. And again, please check all that apply because you might have more than one of these that it is applicable to you. So we have just a couple of you who are students, just a few of you who are new grads. A lot of you are licensed at the associate level. Most of you are independently licensed. That's 57% of you. 16% of you are supervisors, and 10% of you are business owners. And looking at where everybody works, which is the next slide, I'm going to click over to that. We have almost 20% of you work at a hospital or health system. A couple of you work at an insurance company, but not very many. A good portion of people work at a community mental health center. That's 16%. We have 2 people at, or 1% at a federally qualified health center, about 13% at a nonprofit. A few of you work at universities, and we have not very many people who work at the VA, which is why it looks like 0%, but at least one person did say that. 16% at a group private practice, 15% of you at your own private practice, and then 17% of you work elsewhere. So I am curious about what the elsewhere is because I thought I was going to cover most things, but there are actually a lot of you percentage-wise who are working somewhere else. So if you want to share about that later, I would love to hear that. And then last but not least, years of experience. So we have some of you who have 0 to 2 years of experience. Almost a quarter of you have 2 to 5 years of experience. A quarter have 5 to 10. 16% have 10 to 15 years of experience. 9% have 15 to 20 years of experience, and 20% of you have 20 years of experience. So I'm going to stop the poll and see if I can close this because it's now covering most of my screen. Okay. Great. So it looks like we have a pretty big range in terms of people who are here, what you do, what your background is, where you are in your careers, which is exciting. And I was hoping that that would be the case. I'm seeing a lot of comments in the chat, and Bonnie said she's going to let me know if there are any questions. So I'm going to come back to that later. Okay. Moving on from the polls, so we just know who's here and where we are. Our professional development is really important to think about over the course of our careers because just like our personal needs grow and change, our professional needs grow and change over the course of our jobs and our careers and our lives. So let's take a look stage by stage, thinking about what we might need throughout our careers as behavioral health professionals. When we are students, we're still learning about the field and how to think like a member of our professions. In our first year, our second year, and beyond, we may have different developmental needs. So if you think back however long ago it was when you were a first year student, maybe you were very green and had a lot of things that you were still learning. Probably most of us did, versus your second year where you have a bit more of a foundation, and then depending on what your program looked like or looks like, as you progress through your education, you'll have different needs. Next, when we are newly licensed or associates or new grads, we're likely still learning about how to fit into the field and probably still developing our theoretical orientation and our approaches to therapy or whatever clinical work we are doing. At this point, we probably don't have a lot of experience or knowledge about the clinical work because we are still new. Although there are certainly some people who have been in the field for a while and who then go back for a graduate degree. So if that's you, great. And you might be in a little bit of a different situation. After we complete all of our supervised hours and we pass our exams and we do all our continuing education, we can get to the level of being licensed independent practitioners, which is where many of you are now. At this stage, depending on where we work, we might be eligible for raises and additional responsibilities along with independent licensure. This is, of course, going to depend on the specifics of our roles or what things look like in the places that we work, but those are certainly things that could be on the table. Also, when we have our licensed independent credentials, we're often able to act as a supervisor, which means that we are on the other side of things from when we were just in training, either as students or as newly licensed professionals. Once we are more experienced and eligible to supervise, we can progress to the level of being a manager or a boss or a supervisor. And I want to be clear, not everybody wants this, not everybody likes supervising, and that's okay too. Clinical supervision courses are available and they are required by some professions. We have to get some sort of additional training and expertise to get to this level in many cases. Hopefully, we're not just promoting people because they have been around for a while. We're hopefully promoting people who are great at what they do and who really value being in a leadership role. Although I certainly have worked with at least one supervisor who I think only took the promotion because of the money, but hopefully that's not you or people you're working with. I do want to highlight that supervision and management are separate skills, and many people don't receive a whole lot of training in either. I certainly have worked with supervisors who are incredibly knowledgeable and skilled clinically, but they don't necessarily have all the management skills to be great at being a manager. I imagine that the other way around could exist, but I hope it's rarer that somebody is a really good manager but not a good supervisor. I haven't worked with anybody where I would say that applies to them, but beware because that could be a thing too. And because we learn and grow in dysfunctional systems when we are in school, and especially when we're early in our careers, it may be the case that as managers and bosses and supervisors, we might inadvertently perpetuate dysfunctional systems. So things like overworking people, expecting unrealistic or unreasonable things. So try not to do that. I'm hoping this presentation will help all of us with not doing that, and know that this is a thing that happens and that it gets normalized sometimes. So be aware of that. Okay. Next is talking about supervision and consultation. I want to compare and contrast supervision and consultation because I think that they have some similarities and some differences. Supervision is usually an ongoing relationship. So it's generally, excuse me, it's generally not time limited, except if there's a specific reason for that. Supervision may be in a group format or in an individual format. It is sometimes required by your job, but not always. Especially if you're not independently licensed, you do need to be supervised. But if you are licensed to practice at a higher level, then you may not be required to have supervision. I still think it's a good idea, but if you work for a large organization, or if you have a lot of admin responsibilities, or are really busy, you may not have supervision as a work requirement. Supervision is usually provided by your work supervisor, but it may be an outside supervisor. As I had said before, supervision is required to become a licensed independent practitioner. We do need to do a certain number of supervised hours. This is going to vary based on our particular license and also the state that we live in. Supervision is either for general professional development or for a specific purpose, and it often includes goal setting and regular evaluation. So it may be the case that you and your supervisor set goals annually, or that you and your supervisor set goals quarterly. I think it's a good idea to have specific things that we're focused on, because that can help with figuring out what continuing education classes should we be taking, or what modalities do we want to learn about, or what populations do we want to work with. And regular evaluation is part of this too. As a supervisor or as a supervisee, we want to make sure that we are checking in. How's it going? What's working? What's not working? What needs to be changed? Could we be doing anything better? Is there something else going on? Okay, so that's supervision. And then we have consultation. Unlike supervision, consultation is more often a relationship with some sort of fixed duration. So this could be like a one-off consultation. I had somebody who reached out to me to consult about a case relating to something that I had worked with a lot at a previous job, and we just talked the one time. Or you could have consultation that is more regular. So this could be like you're training in a particular therapy. I know at one of my previous jobs, the way that we did consultation was that we would have our training in the new therapy, and then we would regularly have consultation with our consultant. And so I think most of the time that was weekly. And so we would meet for 6 months and we'd review cases and we'd talk with the consultant to be able to learn about what was going on, and we'd talk about how to apply the specific therapy. Again, consultation may be group or individual, depending on the specific need and depending on what makes the most sense. I've had individual consultation where I met with somebody to address specific concerns that I had, but that other colleagues on my team didn't have because they weren't learning about that particular therapy at that time. Consultation is more frequently with someone who's not on your regular work team as opposed to supervision, and it is most likely focused on a specific purpose rather than for your general professional development. Okay. Codes of ethics. I do not recommend what I did to prepare for this slide, but I did it so that you don't have to, which is that I looked at all of the codes of ethics for psychologists, social workers, marriage and family therapists, and professional counselors. I even started to look at the codes of ethics for other professionals we might work with, like doctors, nurses, physician assistants, but I found that it was less relevant to this, so I didn't include it. Across disciplines, there are core ethical principles, and though they are presented a little bit differently profession to profession, they are pretty consistent. So we have these 7 core ethical principles: honesty, being truthful; integrity, if you say you're going to do something, you do it, so you follow through with your commitments; justice, treating people in a way that is both respectful and equitable; autonomy, acknowledging people's right to make decisions; beneficence, working for the good of individuals and society; and then non-maleficence, also not causing harm; and confidentiality, protecting privacy. So if for some reason you also want to look at all the codes of ethics, you can see which ones I referred to there in the footer. And these principles are going to show up across ethics decisions throughout the course of this presentation. So you'll notice that I'll reference them a couple of times later. I also wanted to talk about peer supervision because we might have supervision where either we're the supervisor or the supervisee, but peer supervision is a little bit different because it's more on an equal footing. Peer supervision is sometimes framed as collaborative or reflective supervision rather than more formal clinical supervision. And as a result of that, it often is not going to count for your hours towards licensure in less formal arrangements. So this might be something like a group of colleagues used to work together and then moved into private practice, and they realized they missed the collegiality of working together and wanted to make sure that they were still able to consult on cases because A, it's fun, and B, it helps with us doing our best work. We do have similar ethical principles around confidentiality, respect, and integrity, just like we do in more formal supervision or more formal consultation. We want to share the minimum information needed as a way to protect privacy, just like if you work for a larger practice, you might not share all of the details about the client or clients you're asking about each time because you want to protect privacy. And when we engage in peer supervision, this allows for networking, relationship building, and continued growth. Why do we have supervision at all, though? That might be something that you were wondering too, because in the scheme of things, learning about the kind of work that we do is complicated, and our training is relatively short, especially for those of us who are master's level rather than doctoral level. So there are a few different reasons that we have supervision. It helps us to grow as professionals. It helps us to stay accountable as we're learning. It offers space for us to reflect on our clinical work, space that we might not take otherwise. It creates time for us to consider new perspectives, especially if you work somewhere where you are incredibly busy. You might not have a whole lot of time and space to think about your clinical work and to think about how is it affecting me, what's going on, what interventions am I using, why am I doing things this way, is there something I'm missing? So supervision creates a dedicated space for that. We can even think about it as creating a container, the way that we can think about therapy or clinical work is creating a container too. When supervision is supportive and meeting our needs, it can even help address burnout and the impact of our work. There are administrative and educational and clinical aspects of supervision, and we need to attend to all of them so that we are effective. In a parallel to clinical work, supervision attends to both tasks and processes. Supervisees have particular needs in supervision. They need the following: supervisors using a trauma-informed approach to supervision, a clear frame and boundaries, having a predictable time for supervision, having predictable expectations for supervision, structure. Some people really like to have an agenda. For other people, that's less important. Supervisees need accountability, including learning about documentation, staying up to date with documentation, because I know documentation burden is very real and is one of the things that many, many people struggle with. Goals, as I had talked about before, we do want to be consistent about setting goals and reviewing them regularly. And learning needs. So thinking about where we are developmentally is part of what we need to do wherever we are in our supervisory experience. Supervision, much like therapy, is inherently vulnerable. And because of that, supervisees really need to have psychological safety. They need to know that their supervisor is going to take them seriously and is going to look out for them and is going to act in a way that protects them and helps with them being able to do the great work that they can do or that they can grow into doing. Supervisees also have the basic needs that exist for all workers. Of course, we're going to talk more about this later on, but as you know, if your work environment is not meeting your basic needs, it affects the quality of work that you can do, and it affects the experience that you have at work. So supervisees need to be compensated fairly. They need to earn a living wage. They need to have paid time off. They need to have a work environment that is physically and emotionally and psychologically safe for them, all of those things. They need consistency and predictability. And last, but of course not least, they need culturally informed supervision that considers the systems around us. So looking at the impact of oppression, privilege, justice, equity, and power. Supervisors have needs as well. I wasn't able to find a source for this, so this is just what I came up with on my own. Supervisors need to have self-awareness and introspection about the relationship dynamics that are present in supervision. They need support from their workplaces so that they can have an ideal supervisory experience. That means that if someone is new to managing or supervising, the number of people they're supervising needs to be appropriate to where they are, as opposed to where they could be in the future. It also means that they need to have a workplace that's set up to account for the needs of having trainees, whether those are students, new professionals, experienced professionals. Supervisors need sufficient time to manage the extra expectations that go along with supervision. So they need to have adequate time in their schedule to dedicate to supervision. They need time for reviewing documentation, things like that. And supervisors need the authority to make and enforce decisions related to supervisees' professional development. So this could be considering raises, promotions, what kind of training they might have access to, things like that. Supervision can have a huge impact. It can significantly affect the quality of your experience at work. And when people leave jobs, it's not unusual for it to be the case that they leave because of management or supervisory issues. Our relationships with our supervisors can have long-lasting effects. Opportunities for growth and development, as I had mentioned. If your supervisor thinks that you're doing well, they may offer you new responsibilities that you wouldn't be able to have otherwise. If your supervisor controls what trainings you have access to, that can impact where you go next, and it can impact the direction that you go in your career. Your relationship with your supervisor can affect what sorts of extra responsibilities you get to take on. So this could be about diversifying your work experience or learning new skills that you might not be able to get if you weren't doing a great job or if you didn't have a good relationship with your supervisor. And our relationships with our supervisors can even have an impact on our general well-being and health. As I had mentioned before, people often leave jobs because of issues with management, rather than it being that they don't like the work, although that, of course, does happen sometimes too. Supervision has three different functions. It has a normative function, setting what's appropriate for ethical practice, helping people to comply with agency regulations. Supervision has a formative function in terms of helping with professional development, building skills, growing knowledge, developing identity as a professional, as a practitioner. Supervision has a restorative function also. When supervision is meeting our needs, it can support our well-being, it can decrease burnout, and it can even improve satisfaction with our jobs. The first kind of supervision that we're going to talk about here is effective supervision. We'll get to ineffective and harmful supervision in a bit. Certain characteristics of supervision are correlated with formative and restorative outcomes. The frequency of supervision. Is supervision happening only once a month? That's not good. Is it happening every other week? That might be appropriate under some circumstances. Is it happening weekly? What does the relationship look like? What kind of working alliance do the supervisor and the supervisee have? How's their relationship going? Are they addressing any issues between the two of them? Are they aligned about what the job should look like? What's the format of supervision? Is it just meeting and talking about cases? Is it including reviewing things more formally in terms of What happened with sessions? Is the supervisor providing live feedback? What's happening? And then there are supervision practices that are associated with formative and restorative outcomes as well. We have modeling, role play, live corrective feedback, other kinds of practices too. So this particular study was a meta-analysis. They coded the studies on different variables, including things like study design, sample characteristics, supervision practices, formative and restorative aspects of supervision. And then in this study, they used the characteristics in groups. So they organized them by the themes that came out of the literature review that they did. They considered supervisor characteristics like personality, expertise, and other factors that might be related to supervision outcomes. They considered the supervisor-supervisee relationship, so the working alliance. And they considered supervisory support and processes. What approach did the supervisor use and how did they offer support to the supervisee? And then the format. What was the frequency and the structure and the amount of supervision that was provided? There are different aspects of supervision that were correlated with formative outcomes. Things like supervisor expertise and knowledge of evidence-based practices, which was found to be important to promote provider adherence to the particular therapy and to also ensure that the provider was delivering quality services. Intervention-specific consultation, which I had mentioned before. So let's say someone is training in EMDR. It's really important that their supervisor have solid knowledge of EMDR and be able to help them with that and other aspects of trauma therapy. Having a strong supervisor-supervisee alliance helps address the formative tasks of supervision. And then having structured supervision with clear goals, formatting content, frequency and structure, and roles and responsibilities helps ensure that supervision is addressing providers' needs in a way that is effective and efficient and generally working well. More about supervision practices and characteristics. So corrective feedback is pretty common in helping with people forming their professional identity and forming professional skills. This kind of feedback lets supervisors evaluate implementation and the quality of services being delivered by their supervisees. It helps ensure that clients are getting good services, high quality services. And then other supervision practices like modeling, role play, and even live corrective feedback are consistent with an experiential learning theory approach to supervision. Characteristics of supervision that promote restorative outcomes. The supervisor-supervisee relationship, because in strong relationships, the supervisee feels safe and comfortable going to the supervisor when they have concerns and is able to ask for support when needed. Supervisory support, which again helps protect against burnout. If somebody does not feel safe going to their supervisor, they're at greater risk for burnout and other negative outcomes. Empathy and praise. There is a lot of power in supervision, which is why I wanted to highlight this. As I had mentioned before, supervision is inherently a vulnerable relationship because the supervisor can have a lot of power over the supervisee, over their career and over their professional development. So if you don't have a good relationship with your supervisor, it could cause significant professional ramifications for you. It might affect where you go next. It might affect what skills you develop. It might affect your health and well-being outside of work. And unethical or harmful supervisor behavior puts the supervisee and even potentially clients at risk for harm, which is why I do think we need to consider the aspect of power. And that's part of the reason that I was really happy that I found this particular article that talked about inadequate and harmful clinical supervision, because it's good to know what that looks like so that we can also know what does adequate or even great supervision look like. So this is a revision of the original framework for harm and supervision. So I'm going to give you the background about the original framework before we move into the revised version, which was the main focus of this article. In the original framework, they considered harmful supervision to be supervisory behavior that causes psychological, physical, or emotional harm or trauma to the supervisee. And then in addition to harmful supervision, there was also bad supervision. Ineffective but not traumatizing, and includes at least one of the following: the supervisor's disinterested and not invested in supervision. This could include them being kind of checked out. It could include them canceling supervision. It could include them not taking the supervisee seriously, all sorts of factors. It could be that the supervisor's not giving timely feedback or evaluating the supervisee's skills in a timely fashion. This means that someone doesn't have the information they need in real time. And it also means that they are potentially missing out on things that they could change sooner. In bad supervision, sometimes there's inattention to the supervisee's concerns or challenges. So it might be that the supervisor is not working with them to address these concerns or challenges, or saying like, oh, you should figure that out on your own, things like that. In bad supervision, sometimes the supervisor is not consistently working towards the supervisee's professional development, their growth, their training. So the supervision isn't focused on the supervisee. And potentially in bad supervision, the supervisor doesn't listen to and isn't open to supervisee's feedback. There may also be a parallel here to the effects of harmful therapy on clients. So that's the original framework. Next, we're going to move on from that. In the revised framework, the authors of this study reimagined things. Instead of calling it bad supervision, they changed the name of it to inadequate supervision. And what they did was they added more objective criteria to the constructs of both harmful supervision and inadequate supervision. And for inadequate supervision, that's what's happening when the supervisee either is unable to or unwilling to do the following: meeting the criteria for minimally adequate supervision, which I'll talk about on the next slide, helping the supervisee grow professionally, monitoring the quality of services provided to the supervisee's clients, and serving as a gatekeeper to the profession. This is not going to be most people's favorite part of supervision, but it is really important. Like, let's say I'm working with a trainee and I just don't think that they have the skills to do a particular aspect of the work. I could talk with them about that honestly and say, hey, you know, you're really great at X, but it seems like you need a lot more support in Y. I think that when you look at what jobs to consider, that's something that could be a factor for you. Like, you could be a great case manager, but I think that offering this kind of service might not be as well suited to you. Things like that. Okay. Minimally adequate supervision. This is across disciplines. For minimally adequate supervision, it meets the following criteria. The supervisor has the proper credentials as defined by their discipline or profession. They have the knowledge of and skills for clinical supervision, as well as an awareness of their own limitations. They obtain some sort of consent for supervision, or they use a supervision contract. They provide a minimum of 1 hour face-to-face individual supervision per week. I know that that's not always available everywhere, but this is what the authors of this study considered minimally adequate. The supervisor is observing, reviewing, or monitoring the supervisee's therapy or counseling session or parts of them. That could be things like watching it live if you have a setup that allows for that. It could be watching a video of the sessions. It could be listening to recorded tape, or if you were old school, it could even be a process recording, like when I was in social work school. The supervisor is also going to be providing evaluative feedback to the supervisee that is fair, respectful, honest, and ongoing. So they're going to help the supervisee grow by giving them feedback in a continual way. So allowing them to see how they're growing and changing and what they need. The supervisor is promoting the supervisee in terms of their welfare and professional growth and development, and they are invested in the supervisee's development also. The supervisor is attending to multicultural and diversity issues in supervision and in therapy or counseling. The supervisor is maintaining supervisee confidentiality as appropriate. There, of course, are going to be some supervisors who are more boundaried than others about sharing information, but in general, supervisee confidentiality needs to be paramount. The exceptions would be if there's something dangerous or risky happening, just like in therapy. And the supervisor needs to be aware of and attentive to the power differential and the boundaries between the supervisee and the supervisor and how this affects the supervisory relationship. Okay, so that's minimally adequate supervision. Next, we're talking about harm in supervision. So we have first harmful supervision. Harmful supervision would be supervisory practices that result in psychological, physical, and/or emotional harm or trauma for the supervisee. There are two essential components. There needs to be at least one for it to be harmful, otherwise it might just be ineffective. So either the supervisor's inappropriate actions or inactions cause genuine harm to the supervisee, or the supervisor engaged in behavior known to cause harm, even though the supervisee didn't consider it harmful. I noticed that there's a bit of a parallel here to mandatory reporting for child abuse or neglect, where it's about action or inaction that caused harm or was known to cause harm. I probably wouldn't have thought of that if I hadn't been thinking about mandated reporting, but I just think it's an interesting parallel. I also think that it's relevant that the supervisee might not consider something harmful, but it still could have been harmful. Also, harmful supervision is not the same as uncomfortable supervision. Uncomfortable supervision could include any of the following. A supervisee brought up difficult topics and it was uncomfortable for them to talk about it, but it was necessary or relevant or important. It could also be the case with uncomfortable supervision that a supervisor shared feedback that was difficult for the supervisee to hear, but it was something that was necessary for their professional growth. So if a supervisor said, hey, did you know that you are doing X, it's coming off as Y, it might not necessarily be easy for the supervisee to hear that, but it could be valuable for them and could help them grow and learn so that they're doing better in the future. Gatekeeping, I had mentioned this before, so it might be that a supervisor says, hey, I don't think that you're ready for that particular responsibility yet. I hear that you're interested in it and I hear that you're excited about it, but I would need to see X, Y, and Z from you before being ready to let you do that. And then, of course, there could be an aspect of uncomfortable supervision where people are needing to focus on protecting clients or public welfare. Like if a supervisee or trainee is doing something that is inappropriate or dangerous or negligent. Okay. In general, supervision is harmful when the supervisee's interests are not primary, but supervision is not classified as harmful if the supervisor was behaving appropriately. So this was acting in ways that respected the supervisee's boundaries, and overall, the supervisory relationship was generally positive and appropriate. I do want to acknowledge that the clinical work that we do is complicated and can be incredibly difficult. And so not being able to have a good relationship with your supervisor on top of that can make work really, really challenging in ways that it doesn't need to be. So that's part of the reason that I think it's really valuable for us to think about ethics and supervision. All right. Examples of harmful supervision. I will not get into all of these in a lot of detail, but I did want to highlight them briefly. Harmful supervision could include some sort of sexual impropriety or intimacy. It could include some kind of aggression, physical or emotional or psychological, or even abuse. It could include boundary violations, so sharing information inappropriately, asking things that are not appropriate, things like that. Misuse of power. That can cover a lot of ground. Harmful supervision could include microaggressions and even macroaggressions against the supervisee. It could include humiliating or deriding the supervisee publicly, especially in front of other trainees or other staff. Or even clients potentially, demeaning or criticizing the supervisee or having a vindictive attitude towards them. Exploitative multiple relationships that resulted in harm to the supervisee or client, or even neglecting to take action which led to harm to the supervisee or client. So there's a lot that can be part of harmful supervision, and it can have short-term or long-term effects. For the supervisee, it might result in some sort of psychological trauma. So changes in their sense of safety, resulting in a sense of mistrust, extreme fears or shame, guilt, self-disparagement. The supervisee may show a decline in their self-confidence. In more serious cases, they may have some sort of impairment in their professional or personal life. And also, supervisees who have experienced harmful supervision may have a significant decline in their mental or physical health. As I had mentioned, harmful supervision can affect us in different ways. And it may be that the effects only last a short time, like a few days, or it could be that the effects last for months or even years. And of course, harmful supervision may harm clients too. If the supervisor is acting in ways that are irresponsible or harmful, it could be that the supervisee and their clients are harmed by these harmful supervisory practices. There were different themes in harmful supervision. The two main ones were professional and ethical harm and psychological distress. So when I say themes, these were from supervisees who were interviewed about their experiences with harmful supervision. For professional and ethical harm, the themes included the following: negligence. So the supervisor was neglecting required duties or modeling unethical behaviors, not providing consistent training, things like that. Supervisor's lack of competence, giving only superficial feedback rather than teaching real skills. Abuse of power differential, so taking advantage of the relationship. This could include forcing the supervisee to self-disclose in different ways, making inappropriate personal remarks, using personal information against the supervisee, or blurring administrative or clinical roles, so asking people to do things that are really outside of the scope of their job. They could do things that would jeopardize the supervisee's professional future, because maybe the supervisee is afraid that the supervisor is going to give them some sort of negative evaluation, or that there could be professional repercussions if they speak up about what's going on. Another kind of professional and ethical harm would be discrimination, racial or cultural discrimination, like microaggressions, explicit racial remarks, lack of cultural sensitivity. And then even the failure to address harm. The agency is not being objective in overseeing what's going on, or even protecting harmful supervisors at the expense of supervisees. And then for the theme of psychological distress, this could look like the supervisee experiencing a sense of isolation or silencing. Maybe they're afraid to speak out about what's going on, or they're feeling guarded, or they develop a sense of professional distrust. Also, there's a sense of self-blame. For some supervisees, they may think that it's their fault that this happened to them. So they might internalize that sense of blame or self-doubt, or they might even think that what happened was their own personal failure. And then the last theme of psychological distress was emotional and physical decline. So this could be the supervisee having intense experiences of stress and anxiety, including a sense of helplessness, hopelessness, feeling traumatized, and maybe even developing physical symptoms like migraines or digestive issues. Okay, next I am inviting everybody to comment in the chat right now. So there are going to be two prompts. I'm going to open things up for the first prompt, and then we'll get to the second. What is the first word that comes to mind when you think of a positive experience with supervision? Okay, it's going to take me a little while to catch up with you because there are over 100 different things that you have said in the chat. Let's see. Oh, okay. Now I see where people are working that I hadn't thought of. Okay, let's see what you were saying. Growth, supported, guidance, safety, empathetic, support, growth, support, connection, receptive, open dialogue. Oh, I'm seeing a lot of support and supportive and supported, kindness, trust, safety, vulnerability, authenticity, empathy, guidance, available. I like that. Alliance, consistent, openness. These are fabulous. Reciprocating, constructive feedback, engagement, mentor, restored, honesty, experience. Challenging is a really interesting one. Relatable, non-judgmental, collaborative, validation. Oh my goodness, you all have such great ideas. I can barely keep up with you. When I get to the has my back. When I get to the bottom here, I'm going to add the second prompt. Teacher, flexibility, proficiency, ooh, allyship, ethical behavior, yes, respectful, knowledgeable, spiritually, that's fascinating. All right. What's the first word that comes to mind when you think of a negative experience with supervision? Oh, okay. I'm just going to highlight this one comment and then we'll get to the negative ones. Honest, open dialogue on controversial, hard discussion on current positioning, validation, empathy, and ethical standing. I'm not sure that I punctuated that correctly, but yes. Inconsistency, dismissive, apathetic, mean, judgmental, dismissive, unreliable, blaming, abusive, manipulative, dismissive, neglectful, unavailable, passive, ooh, vague, um, disciplinary, tense, uncomfortable. I see a lot of judgmental, ooh, passive aggressive, yes, unavailable, non-attentive, closed-minded, harsh, disappointed, yes, absent, unavailable, superiority complex, that's a really good one. Dismissive, uncaring, not knowledgeable, inconsistent, uncomfortable. Yes. Oh, bigoted. I'm sorry you experienced that. Unethical, judgmental, negative, harmful, alienating, biased, plays favorites. Yes. Mean, belittling, short-sighted. Yes. Okay, that's an excellent one. Judgy, domineering, unavailable, ineffective communication. Seeing, oh, micromanaging. Yes, definitely. Ego-driven, uncomfortable, cold-hearted. Ooh, unprofessional. Psychopathic. Oh my goodness, that's alarming. I am sorry that you had a supervisor who made you think of that. Unqualified. Being a boss as well as a supervisor, interesting. Oh my goodness, it sounds like you all have had a lot of experiences with bad supervisors like I have, and I'm really sorry for that. I'm seeing some really awful things that you think of. I'm just going to highlight this because it's outrageous. Somebody said the supervisor described the supervisor as incompetent and said the supervisor did a group supervision where he discussed how we should have our nails done before going on a job interview. That's outrageous. Narcissistic, forgetful. All right, I'm going to highlight just a few last ones and then we are going to move on from here. Ooh, this is really bad. Putting profit over patients, safety, and ethical practice. Eek. Disrespectful, unavailable. Um, to the person who just said, I've had bad experiences to the point I basically quit supervision altogether. I am so sorry. And I can understand how you got there. All right. Oh, I'm really glad that you said that you had a culturally sensitive and validating supervisor. Okay. Thank you so much. That is alarming, and I'm really sorry that you had a supervisor who was outing supervising this in the practice. That is not acceptable or okay. Thank you. Like I said, I could tell you were going to be a good audience when you were participating right away, and you have not disappointed. This is the first opportunity for questions, and I can see that many of you have a lot to share. I would love to hear questions that you have. To the person who sent me a private message about law and ethics requirements for California, I'm not able to answer that, but if you message Bonnie, she may be able to help you. Um, does anybody have a question right now? I'm going to give it another moment. Okay, yes, thank you. Um, I see a couple of questions and I'm going to try to answer them, and then we'll go to the next section. Sarah, when it gets to the point of a write-up, how do you balance this with the avoidance of the power over approach? I don't know the answer to that, but I think that this would probably be a good opportunity to consult with someone you trust who's not at your current workplace to get a sense of what might be going on and how you might be able to handle it. That sounds really alarming, and I'm sorry that that's going on. I don't know that I have an exact answer for you, but I would say consult with people who are closer to your specific situation and see what they can do to advocate for you. Daniel, let's coming from a different culture than supervisor. I'm not entirely sure what your question is, so if you could rephrase that, I will try to answer it. Ooh, Jennifer, I love this. How can I prepare to become a good supervisor in the future? This is an excellent question. I would say you can prepare to become a good supervisor by learning a lot and by taking care of yourself and by setting good boundaries and thinking about what you can learn from everyone, including the people who are teaching you what not to do. I have had great supervisors, like I've mentioned, and I've had supervisors where I was like, I don't understand why you're doing this or why you think this is okay, but I don't have the power to fix it. So I mostly fix things by leaving, which I can't say that I would recommend that to everybody, but it ended up okay for me most of the time. Um, What is the expectation when the supervisee comes to supervision? Oftentimes I don't have questions, but feel I should. Okay, well, my thought would be talk with your supervisee and ask about how things are going. One of the frameworks that I learned for asking about feedback when I took the CFE course was when you are asking your supervisee about how things are going, you can ask what is called stop, start, or continue. So what would you like me to stop? What would you like me to start doing? And what would you like me to continue doing in our supervision? So maybe if you feel like you should have questions, are there things that you want to talk about with your supervisee that you haven't yet? Or are there things that you would like to make sure that you get to in the future? Okay. What recommendations do you have for those transitioning into a supervisory role? I would say try to find a great mentor and learn from them, and also ask what resources your organization has to train you. So ask if you can take a course on supervision, ask if you can take a course on management. There are, of course, free resources available, but I think if you can take a course, that would be great. If anybody wants resources after this presentation, please feel free to email me personally and I will offer you recommendations. I'm like the queen of recommendations for resources, so please ask. Bonnie says, if you have any questions about CE, credit, attendance, or today's session, reach out in the chat to Bonnie. She is happy to help. I cannot answer that, but Bonnie can. Thank you, Bonnie. Sophia, what is the best approach to terminating a poor supervisor without jeopardizing one's job? Okay, that is a good question, and I think some of it is going to depend on your organization's policies. Follow your policies really diligently because you want to make sure that you are covering your bases. I think too, supervisors inherently have more power than individual contributors and people who are more in the boots on the ground role. So be really careful about this, and also try to do things in a way that is thoughtful and respectful to the extent possible, and that treats the person with dignity. The way that I like to think about this is that somebody might be poorly cast. So I have a theater background, although I don't work in theater now, and I never have. So if we think about it like you're the casting director, would you have cast this person for this role? Maybe not, but maybe they'd be great in some other part. Kathleen, are some codes of ethics easier to sustain than others? I genuinely don't know how to answer that because I think that there's a lot of overlap, and I think that we can't really change professions easily. So I think that it would be worth thinking more about that on your own and with some trusted colleagues. Okay. Um, let's see. Does age difference impact the relationship? That is an interesting question, and I'm going to say probably, but it can show up differently person to person. I think that there can be cultural differences based on our age, which is weird because we don't usually think of age as culture. But if you think about, say, somebody who is a boomer versus Gen X versus a millennial versus Gen Z, they're likely to have a really different conceptualization of their relationship with work. So I'm going to say yes to James's question. Zamaria, I don't know how to handle that, but I hope that you have somebody who you can trust to go through that. I don't want you to be in trouble about that, and I want you to be able to renew your license successfully. Is your supervision license regional or national? Leonard, that is a good question. So you need to check with your particular profession for that, but generally, you're only allowed to supervise in states where you're licensed. So I'm a social worker. The social work licensure compact has not gone into effect. I'm not allowed to supervise somebody working outside of Pennsylvania because that's where I live and where I'm licensed. So that's going to depend on your discipline. If you are a psychologist and you're licensed through SciPact, or you have multiple state licensures, check with your board. Let's see. Oh, okay. Daniel, you rephrased your question. Let's say coming from a different culture than the supervisor. Yeah, so supervisory relationships are affected by culture too. And if you and your supervisor come from different cultural backgrounds, you may have different expectations and different things that you are thinking about in terms of your work. So you might need to talk about it, just like you might need to talk about it if you had cultural differences between you and a client. Oh, well, sorry, Daniel, I didn't see the other part of your question because there was only so much of the chat that I saw. The upshot being the supervisor saying this is the way you go about doing so and so when it's culturally incorrect. Maybe you can educate them, maybe you can advocate as a group. Um, Melissa, any recommendations or resources on courses or programs to help prepare to be a supervisor? Ask your colleagues for something locally and look at local universities. Lisa, if you work for a larger organization, they may have internal educational opportunities for those with a goal to become managers. Exactly. Um, okay, transitioning to a supervisory role if you don't have much experience or guidance from your employer, try to supervise interns if you can, but also see what you can do to take on extra responsibilities and be awesome at your job and see if that helps. Okay, this is really great. Thank you for sharing this, April. So this ties into somebody's question about what questions should I be asking my supervisees. During my supervision, I always ask my team members how they are as a human. As a supervisor, it's important to understand that our people are people first. Being a holistic supervisor who understands that has led to me being able to build rapport quickly with the team I support. You sound awesome. I love that, April. Yes, Nancy, I can repeat the name of the course where I learned start, stop, and continue. It was the Supervision in Field Instruction course, which I took at the University of Pennsylvania, which is local to me. It's the required course for new social work supervisors. Okay, oh, um, this is a good question, Deborah. I've had grad students in training and interns ask me, I don't know what I don't know, so I don't always know what to ask my supervisor. How would you address this as a supervisor of interns? And I have someone commenting below as a student intern, yes, this is such a helpful question. So I think the easiest thing to do is to try to set expectations at the beginning of the time you're working together. But if you can't do that because you've already been working together, that's okay too. Say, like, I don't know is okay. I really want to normalize the fact that we don't always know things and that that's normal and appropriate. And someone who never says, I don't know, or who always claims to have the answer, I don't trust them. I'm just going to be honest about that. So if if your supervisor is asking you great questions or your supervisor asking great questions, hopefully you'll figure out together what you don't know, but also supervisees, especially grad students, you can always bring things from what you're learning in school and say, like, we read this article about such and such, can we talk about it? Or one of the other students in my program brought up X in our class, and can we talk about it? Okay. What criteria should one use when searching for a supervisor? Ooh, I want to write a blog post about that. I think you should talk to them first. Try to get a sense as to their approach to supervision. The things that I think are most important in searching for a supervisor is that you have some sort of similar orientation in terms of the theories that you use. It doesn't have to be exactly the same, but that would be helpful if you're learning to grow. I think also you want to make sure that you're aligned about what supervision will look like. You want to talk about fees if you're going to be paying somebody for outside supervision. Maybe even ask them if you can talk to some of their prior supervisees. I love that. Okay. Yes, this is a good suggestion about how to let somebody go who's doing a poor job as a supervisor. Document issues and concerns when you're thinking about letting somebody go, including how they're working on correcting problems. Yes, I'm not going to read this comment, KJ's iPhone, but yes, I'm sorry. Yes, Angela is right. Supervisor criteria is state specific. Nina, Diana, yes, expectations and supervision. Consider what the supervisee is bringing in, specific patients or clients, groups, self-care, education they're interested in, workplace problems, things like that. Okay. How would you advise to sustain camaraderie amongst your team while meeting the company's expectations that could be stress-inducing? I would say try to buffer things when you can, if you're the leader, but also acknowledge that these things maybe aren't okay and might not be sustainable long-term. As much as you can, really, really, really encourage people to take paid time off and give them paid time off. If you work for a place that doesn't give paid time off, try to advocate for that. Also, do what you can to advocate for better policies. Yes, social workers do work with really complex clients, and it's hard to deal with that sometimes. Yes, Brooke, I like this. I always interview supervisees to ensure we're a good fit, professional goals, experience, and population of interest. Jennifer, you're unclear on the requirements for being a supervisor. Look at your local state professional clinical social work organization. It's in Pennsylvania. It's the Pennsylvania Society for Clinical Social Work, but wherever you live likely has a clinical social work association. It's going to depend on the board in your state, so I can't speak to that because we have people here from lots and lots of different states. All right, that was rapid fire questions. Thank you, everybody. You are awesome. We are going to move on, and I'm going to hold future questions to the next spot. Okay. Here is my favorite ever article about supervision. And like I said, I'm aware that this makes me very nerdy and I'm fine with that. This article is on attachment in supervision, and it is really, really great. If you only look at one of the sources that I recommend from this presentation, please, please look at this. I think it'll be really helpful for you. So we have our basic attachment styles. Secure, which is low anxiety and low avoidance. We have anxious, which is low avoidance, high anxiety. We have low anxiety and high avoidance for our avoidant or dismissive attachment style. And then we have our fearful or disorganized attachment style, which is high avoidance, high anxiety. Here is our very short overview of attachment styles. This is very short because you are all educated people, and I imagine that you are likely familiar with this to some extent already, or perhaps to a great extent, depending on your orientation and interests. Okay. First, we have our attachment styles in childhood, and these are approximate. It's not like 100% these are the only attachment styles that exist, but these are basically what exists. We can have a secure attachment style. We can have an avoidant attachment style. We can have an ambivalent or resistant attachment style. And we can have a disorganized attachment style. So those are our basic four for children. And then we have our attachment styles in adulthood. We have secure, we have dismissive, we have preoccupied, and we have unresolved. Now, I know that I said that we have each of those four attachment styles as kids and as adults, but our attachment styles can change. They're dynamic, not static. And it is actually a myth that our attachment style is fixed as kids and as adults. What is truly happening is that our attachment styles show up differently in different relationships. And we may have one main attachment style that presents for us, but we may have more than one. So it's possible that you could have a secure attachment style in one relationship and an anxious attachment style in another. Think about somebody who has a really great and secure relationship with their partner and who maybe has more of an anxious attachment style with their family. We want to consider how different relationships function differently. So it might be the case that you basically have a secure attachment style, but that being around certain other people leads to you acting in a way that's more characteristic of another attachment style. Or maybe you basically have an anxious attachment style, but with the right people, you behave in more of a way that's like a secure attachment style. Again, while one attachment style may fit you best, it's not unusual to show aspects of multiple attachment styles. Okay, I love this graphic and I love the next graphic. This is the circle of security, which is how the parent or caregiver attends to the needs of their child. We have the hands acting as the secure base and the safe haven. The secure base is that it's okay for the child to go out from there to go exploring, and the safe haven is it's safe to come back. Kids need their adults to support their exploration. So we have the kid who's taking the toys and going exploring. Kids need their adults to watch over them and enjoy being with them, be excited about what they're doing, help them out. So that's the secure base piece. And kids also need their adults to be a safe place to return to. So that's the safe haven. Kids need their adults to welcome the kids coming to them and to act in ways that protect them and comfort them, to delight in them, and to help kids organize their feelings because they're still learning about that. The takeaway here from the circle of security is that adults always need to be bigger and stronger and wiser and kind in their interactions with the kids. Whenever possible, follow the child's need, and whenever necessary, take charge. So that's the circle of security for parent-child relationships. But we have a parallel. It's the supervisor circle of security. So this is about the supervisor attending to the provider's needs. And everybody who had trouble with your supervisors and everybody who had great experiences with your supervisors, I hope you'll find something to relate to in this. So as supervisees, we need our supervisors to be the secure base and the safe haven for us, just like kids need that from their grown-ups. And so the supervisees need the supervisors to allow them to explore ideas and feelings and also shark music. This was a new term for me. I hadn't learned it before. Shark music is something where we're often not aware that it's playing in the background. Think about Jaws. What the shark music is our past experiences telling us that we should either be afraid of or uncomfortable with a feeling or need that is actually safe. So that's shark music. I know this graphic uses the term shark music in a few different places. Now you also know what shark music is, and if you want to teach other people about it, by all means. I figured out what it was because I looked up circle of security shark music and got a YouTube video that was a dad and his daughter at the playground. Okay. Supervisees need supervisors to be enjoying their work together, celebrating successes, delighting in the good work that they're doing, making space for their struggles, understanding their clients' needs, and recognizing shark music. So again, this is our past experiences telling us that a feeling or need is unsafe, but it's actually okay and safe. So those two are the secure base. We're going to be thinking about that as the top of the circle when we get to the next set of slides. For the safe haven, or the bottom of the circle, supervisees need their supervisors to welcome them coming to the supervisors for support and co-regulation in managing feelings together. Supervisees also need their supervisors to help protect them so they don't feel like they're managing their feelings alone. They need their supervisors to act as a comforting presence and to enjoy this aspect of supervision. And again, help with organizing feelings and managing shark music. All right. I encourage you to take a look at this article, which I've linked in the references section at the end, because it's great, and also because I had to kind of compress this chart to be able to make it fit on slides. It's actually just one table, but I smushed it into 4 separate ones so that we could take a look at everything and actually read it. So what's going to happen here is we're going to look at supervisory relationship dynamics, one attachment style at a time for each supervisor, and then all 4 going across for the supervisee. So our first chart is the secure supervisor. If the secure supervisor, and I'm using secure and preoccupied and dismissive and unresolved as shorthand because I don't want to say supervisor with the secure attachment style each time because that's annoying. So the supervisor who has a secure supervisee, they're likely to have a safe and secure and encouraging relationship for their supervisory relationship. So this is one where the supervisee can go to their supervisor for support and know that they'll receive it. They can go off and do their own thing and have some autonomy and know that the supervisor is not going to drag them back. For the preoccupied supervisee, so this is the top of the circle challenges, the supervisee is having problems with going away from the supervisor and being autonomous. This supervisee is looking for a high level of reassurance from the supervisor. So they don't necessarily trust their own instincts. They don't necessarily feel safe using the autonomy that they could have. Next, we have our dismissive supervisee, which would be someone who's having bottom of the circle challenges. So it's hard to come to the supervisor for safety and co-regulation. The relationship here is one where the supervisee is seeking limited support due to worries about being seen as incompetent. And then we have the unresolved supervisee. In this circumstance, the relationship is going to feature inconsistent and unpredictable supervisee behavior. Next, moving from our secure supervisor to the preoccupied supervisor, this is the top of the circle challenges again. With a secure supervisee, but a preoccupied supervisor, there's high supervisor anxiety and a more prescriptive approach to supervision. With a preoccupied supervisor and preoccupied supervisee, the supervisor is afraid of offering autonomy and the supervisee fears autonomy. So that is tricky as well. With the preoccupied supervisor and the dismissive supervisee, the supervisor is giving the supervisee excessive support and guidance beyond what they need. And so the supervisee doesn't feel great about coming to them because they're not getting what they need. And then with the unresolved supervisee, we have inconsistent behavior and boundaries in supervision. Next, we have the dismissive supervisor. So this is the bottom of the circle challenges. With the secure supervisee, the supervisor is promoting independence in the supervisee rather than offering them support and comfort, which may then be the case that the supervisee feels confused. With the preoccupied supervisee and the dismissive supervisor, the supervisor is uncomfortable with what they perceive as neediness, and the supervisee is uncomfortable with autonomy. So this may create a kind of chasing dynamic. And what I mean by that is if you think about how our attachment styles can show up in dating, if someone has an anxious attachment style, they want to get closer. And if they're in a relationship with somebody who has a more avoidant attachment style, they feel uncomfortable when the other person gets too close, so they move away, and it creates this kind of pattern. Because I think the other person is either too needy or not close enough. Then we have the dismissive supervisor and dismissive supervisee. In this relationship, both people are uncomfortable with seeking support or receiving support, which is then likely to limit the growth for the supervisee. And then we have the dismissive supervisor and unresolved supervisee, which is likely to result in a tense, uncomfortable, and unpredictable dynamic in the relationship. And last but not least, we have the unresolved supervisor. So with the secure supervisee and the unresolved supervisor, you may see unpredictable supervisor behavior, and then the supervisee may feel responsible for managing affect in the relationship. With the unresolved supervisor and the preoccupied supervisee, this relationship reinforces dependence, but there may be problems when the supervisor is not able to manage the supervisee's emotions. With the unresolved supervisor and the dismissive supervisee, the supervisee feels uncomfortable and may even avoid supervision because of the supervisor's emotion management issues. And then with the unresolved supervisee and the unresolved supervisor, there may be a sense of misattunement, resentment, hostility, and confusion here. All right, this is another time to share in the chat. What have you experienced in supervision? How does the lens of attachment help you make sense of your experiences? Please feel free to share a few words in the chat about your experiences as a supervisor or as a supervisee. And I do mean a few words because there are a lot of you and you have so many great things to share, and I want to highlight lots of things. Nina, yes, there is a link to the article on attachment and supervision in the references. Oh, Nicholas, thank you. That was incredibly fast. Paige, thank you for the recommendation. Circle of Security Training sounds cool. That is the organization that made those graphics. Let's see, we have good knowledge, growth and confidence, great supervisor. I've had secure, supportive supervisors, but their effectiveness seemed to be limited by time being busy. Yeah, that's very relatable. Curious now about my attachment style as a supervisor. Collaboration and support, felt fully supported, effective. This is a really interesting comment, Tanisha. I hope I'm pronouncing your name correctly. Attachment rarely comes up in supervision. I usually receive little to no feedback or suggestion. Supervision has been more so consults and venting. Okay. I get really good guidance and believe we have a secure attachment. Oh, dismissive, and I was afraid to bring things up due to fear of judgment and ridicule. Feedback, lack of openness to feedback. I like this. Attachments help me rationalize behaviors and practice healthy interpersonal skills, supportive connection, brave space that has encouraged growth, confidence and good support, extensive experience in the field and compassionate. Ooh, I like this one. Knowledgeable, relatable, available. Support and collaboration, openness of supervisee. Ooh, I like this. I felt super supported by my supervisor. It really helped my confidence. Growth. Collaborative and supportive. Growth. A wide variety of supervision experiences, and this brings this into perspective as I feel it and see it. I've learned a lot about my specialty. Okay. Well, I'm very happy for you, Denicia. I have a secure and supportive supervisor. I have nothing negative to say about my supervisor. She helps me with my clients. Great. Confidence, encouraging, supportive, and knowledgeable. Yeah, I'm sorry that you had that experience in community mental health settings where you didn't have supervisors available. Okay, parallel process of growth and partnership. Okay. Supportive, reassured, helped build competence and confidence in decision making. Okay, these are great. I am going to stop sharing these for a moment because I do want us to move on. Okay. Um, so we're going to do questions here, and then take a break after this slide. Any questions now? Okay, I'm going to give 2 more minutes for questions, and if there aren't questions right now, we're just going to take a 10-minute break and come back. Okay, looks like people have a lot to say, but do not have questions right now. I'm going to give everybody 1 more minute, and then yes, I was hoping that you would be interested in the parallel relationship therapist client attachment style too. Okay, I've seen no questions. I think we're just going to take our 10-minute break here. So it is 11:42 where I am, so it should be on the 42 where you are, unless you are in a different time zone. So let's pause for now, and we will come back in 10 minutes. And feel free to go off camera if you're on camera. I am going to do that as well. Okay, welcome back, everybody. I know Bonnie had just been showing a slide about future agents of change events. Bonnie, did you want to show that again now, or did you want to show that again at the end?
I can show that again at the end. Just wanted to share it during the break, but I really appreciate all the questions coming in. And we don't need to let us know that we're back. I see everyone here as we're coming back. So just welcome back, everyone. We'll turn it over to Latia here to continue on our topic. Thank you all.
Okay. I will also want to highlight that you all asked so many questions that I may not get through all of my content. So there are a couple of things that I might end up shortening. It doesn't mean that it's not important. It just means that I want to make sure to keep things moving. So we obviously deal with a lot of different difficult things in our professions. And so I wanted to take a little bit of time to talk about trauma and burnout, because that can be part of what happens with supervision too. Okay, so there are a few different concepts related to burnout, and we're going to talk about those. The first is just burnout, what that is. The World Health Organization definition is that burnout is a syndrome that results from chronic workplace stress that hasn't been managed successfully. Has 3 parts: sense of energy depletion or exhaustion, increased mental distance from one's job or feelings of negativism or cynicism related to one's job, and decreased professional efficacy. Now, technically, the World Health Organization definition just refers to phenomena at work, and it shouldn't be used to describe experiences elsewhere, but I know that we use burnout to explain how we're feeling in other contexts of our lives too. So just know that. The general definition that we can use from the book Burnout, which I will talk more about later, is when you're overwhelmed and exhausted by everything you're doing, yet also feel like you are still not doing enough. There are a few different concepts that are similar to or related to burnout, and I'm going to highlight each of them briefly. I assume that you may be familiar with some of these, just given that it sounds like you are a really knowledgeable and skilled audience. We have post-traumatic stress, which is symptoms related to at least one past traumatic experience. This can include intrusive memories, fight, flight, freeze response, avoidance, emotional symptoms, cognitive symptoms. Secondary traumatic stress, which is symptoms of post-traumatic stress that result from the indirect exposure to traumatic material. This has also been called compassion fatigue, which is a term suggested by Charles R. Figley. We have vicarious trauma, which is changes in the experience of the helper related to empathic engagement with an individual or situation affected by trauma. Vicarious trauma mainly is talking about cognitive changes that take place after repeated exposure to other people's trauma, and it impacts thoughts and beliefs about trust, relationships, safety, control. And then we have burnout, which again has our three parts: reduced sense of satisfaction, emotional exhaustion, disconnection from self and others. And we also have compassion satisfaction, which is when we have positive feelings related to competence and mastery. When we feel a sense of compassion satisfaction, we have positive relationships with other people, especially at work. And we have a sense that through our work, we're contributing to society and to individuals. Signs of burnout. People feeling burned out may experience fatigue, negative emotions, social isolation or disconnection from others, sleep problems, avoidance, illness, and even poor self-care. There are burnout prevention strategies that we can use, including things like learning about burnout, establishing and maintaining healthy boundaries, holding ourselves and others accountable, talking with trusted people about how our work is affecting us, making time for regular learning opportunities, particularly outside of work and outside of our regular scope of work, exercising regularly, eating well, sleeping well, engaging in hobbies and fun activities, taking vacations, finding and building community, and making time for creativity. Warning signs of burnout. This can include problems with sleep, so falling asleep, staying asleep, or waking up too early. Increased negative emotions, things like guilt, anger, sadness, hopelessness, worry, shame. Reduced motivation and sense of achievement. Decreased interest in activities that you usually enjoy. More problems than usual in personal, professional, and romantic relationships. Poor eating habits like unhealthy diet or changes in appetite. Distractibility or problems with concentration, and irritability. We can address burnout in different ways: through mindfulness, through reflecting on how our work is affecting us, whether it's paid work, volunteer work, or other work, seeking help from a therapist, diversifying what you do to maintain a sense of balance, focus, and interest, and even sometimes changing jobs or changing careers can help with addressing burnout. There's a lot of stigma that goes along with burnout. Regardless of why it happened, it's often perceived to be a sign of weakness, failure, and incompetence. When workers experience burnout, they often are rightfully concerned that people are going to treat them more negatively. And unfortunately, this is realistic because many workers perceived shame or judgment from coworkers or supervisors as a result of burnout. In the past, some company leaders even thought that burnout was helpful because it meant people who couldn't handle the job would either quit on their own or leave on their own, and then they didn't need to be managed out or fired. Some principles for trauma-informed care. In trauma-informed care, everyone is aware of the effects of traumatic stress on anybody in the system, including children, caregivers, and service providers. This information is from the National Child Traumatic Stress Network, so it is specifically focused on kids, but it could apply to anybody. Trauma-informed programs and agencies incorporate knowledge, awareness, and skills relating to trauma into their organizational cultures, practices, and policies. And these systems work together to promote health, safety, recovery, resilience. Okay, I'm not going to go into all of the details on this slide because, like I said, you have all asked so many great questions and I want to make sure to cover all the content and have time for more questions. But trauma-informed systems are holistic and are using the knowledge that we have about trauma to make things work better for everybody. And the reason that trauma-informed organizations are doing activities in this specific way is so that they can build meaningful partnerships that create relationships, and so that they can address how trauma interacts with culture, history, race, gender, location, and language, and acknowledge structural inequalities and consider the unique needs of diverse communities. Secondary traumatic stress, I already talked about this a bit, so I'm not going to get into this very much now, again, in the interest of time. But secondary traumatic stress is the emotional distress that occurs when we're exposed to other people's direct trauma experiences. And this can be really pervasive. And if you're not screening for trauma in the population that you see, it might be that there are things happening that don't make a whole lot of sense, either organizationally or individually. Secondary traumatic stress is a major issue for anybody working with kids and adults with trauma histories, and the risk is higher for women, highly empathetic people, and anybody who has unresolved personal trauma. There also may be specific circumstances where the risk is higher, like if you have a high caseload of individuals with trauma on your caseload altogether. If you are feeling isolated socially or in your organization, and if providers don't have adequate training, they may not be able to do their best work. Secondary traumatic stress can negatively impact client care and lead to professionals leaving their jobs or even the field. There are different strategies for prevention and intervention. I hope that if you are in a position of leadership that you are practicing some of these things already, but if you're not, the National Child Traumatic Stress Network is a great place to go to learn about this. We want to consider different strategies for both preventing and intervening with secondary traumatic stress. They are similar to the strategies that we'd be using for preventing and intervening with burnout. Building resiliency. Organizations can set up policies that help with people having experiences that are safe and that build resilience and that are informed based on what we know about the impact of trauma. And individually, there are things we can do also. We can use supervision, we can educate ourselves about secondary traumatic stress, put systems in place to help us have good work-life balance, practice good self-care, stay connected to others, use the resources that exist. I'm going to breeze through these next few slides as well, because I want to get to the more interesting parts about changing work. So when we're thinking about building resilience in trauma-informed systems, again, prevention and intervention, acknowledge how trauma impacts us on a primary and secondary level, and understand what we need to know about trauma to be able to set up policies, procedures, services that are effective and helpful. I'm skipping this slide for questions because I want to get to some of the other topics. Okay, this is some of what I think is particularly interesting and what I think you probably wouldn't see in most trainings on ethics and supervision, so I am excited to share it with you. We can think about the hierarchy of needs from Abraham Maslow as informing what we need at work, because it does. So we have our basic needs, our body needs, food, water, warmth, and rest, and our safety needs for security and safety, our psychological needs for belongingness and love and social relationships, and our esteem needs, prestige, and feeling of accomplishment, and our self-fulfillment needs, self-actualization for achieving our potential. So for the next slide, I wasn't able to find what I was looking for in the literature, so I just came up with it myself, which is I'm proposing that there is a parallel workplace hierarchy of needs. We have our physiological needs at work. We need food, water, bathroom breaks, etc. We need safety and security, physical, financial, psychological. We have social needs at work, so we need a meaningful sense of connection and relationships. We have esteem needs, and we need to have that sense of accomplishment and fulfillment and self-actualization. Problems at work are systemic. Even if you work somewhere that says that it's trauma-informed or that they provide a psychologically safe environment, the people you're working with most likely had other jobs that were not in healthy workplaces, unless they're really, really lucky. You might have different ideas about what those terms mean, and unfortunately, in a lot of cases, the supervisor has more authority and power than the supervisee, even if they're wrong. People's actions and words don't always match, and as I had said before, many times supervisors will inadvertently replicate unhealthy symptoms even when they're trying not to do that. And because there are a lot of problems that are pervasive in behavioral health, I wanted to highlight them so that you know what to watch out for. the devaluing and undercompensation of care work. When I say care work, that can include things like home health care, education, therapy, social work, and nursing. The nonprofit funding model, lack of sufficient public investment in social services, especially in the US right now. The implicit expectation in many workplaces, particularly nonprofits, social work, teaching, nursing, that passion compensates for money, which it does not. I cannot pay my bills because of being enthusiastic about my job or because of caring about my job. A professional culture of sacrifice, which is pervasive. Rise of private equity and venture capital. If you want to learn more about this, I recommend Megan Greenwell's book, Bad Company, where she interviewed 4 workers in different industries about what their jobs were like before, during, and after the organizations were taken over by private equity companies. It was really interesting, also sad, but really interesting to read. The increase in gig work and remote work over the past few years can result in more disconnection from coworkers. And the problems in healthcare that had already existed got worse because of the COVID-19 pandemic. Healthcare isn't a factory. Most models for healthcare are fee-for-service rather than subscription-based or preventive. There is a limit to how many appointments you can have per day, considering time, capacity, and quality of care. And the increasing influence of venture capital, private equity, and AI have worsened pre-existing problems with productivity expectations that weren't so realistic to begin with. Unless you're working in some sort of other model, like providing group therapy or support groups or other offerings, the one-to-one model means that you can only offer so much time, care, and attention to your individual patients or clients in a given day and still maintain a high-quality service. Health insurance reimbursement has not kept up with the cost of living, and health insurance reimbursement is lower for mental health services than for comparable physical health services. Low reimbursement rates are a major reason that practitioners are out of network, and the cash pay rates that private pay providers charge and the reimbursement rates insurance offers differ significantly. This is a really shocking one. On average, insurance companies dispute claims twice as often for mental health services compared with physical health services, which can result in clawbacks. If you don't know what clawbacks are, they are when the insurance company will take back the money they already paid for a service that was already delivered. So that's a problem. If somebody works for an organization that accepts insurance, they might need to have extra money available for that so that they have money to cover the fact that that may happen. The ProPublica Why I Left the Network article is a nice summary of reasons that many therapist practices have chosen not to take insurance or have stopped taking insurance. And the Psychotherapy Action Network did an extensive study about the influence of practice management companies on private practice, which you can read at this link. I will talk more about practice management companies later. Also, wages have not kept pace with the cost of living. Minimum wage has not kept pace with productivity. If you look at this graph, if minimum wage tracked productivity since 1968, it would now be above $20. The federal minimum wage is actually about $7.25, or is in fact $7.25, though some states and cities have higher minimum wage requirements. Also, the gap between productivity and an average worker's compensation has gone up significantly since 1979. So prior to 1979, 1948 to 1979, productivity and compensation went up at about the same rate, but that hasn't been the case since 1979. This is from the Economic Policy Institute. So how can we make things better? This is a time where I am interested to see what you all think. So I have a few different quotes that I'm going to share, and then I'd like you to chime in the chat what number you think applies to the category of workers we're talking about. Number 1, platform companies Originally offered workers a lucrative alternative, but as time went on, cuts to wages and changes to commission structures meant it was hard to earn a living. So these are all about the same thing. They're all from the same source. The promise of good pay and flexibility has attracted many. Unfortunately, the fierce competition for market share has turned into a rapid race to the bottom. Increased monitoring of workers felt like surveillance, control without respect. And then the platforms touted partnership and empowerment, yet workers like Gabe saw through the facade. These companies are treating us as employees, he protested, but they don't give us the benefits of employees. If you're forced to do the work, even if it's not to your advantage, you're not an independent contractor. You're an employee. You just don't have the benefits. So who are we talking about? Are these workers freelancers, Amazon warehouse workers, multi-level marketing reps, therapists, drivers? I am going to open the chat and catch up with what all of you have been saying and see what everybody thinks. So just put the number in the chat and I'll see what we have and then we'll go on. I am seeing some fours, a lot of fours. 2 and 4, interesting. All, it's not everybody. The quotes are from something specific. For all, for lots of fours, all. Essentially all. Okay, I'm glad I chose well. I see 1 5, but another 5, but the majority of you are saying 4s. Another 5, all. Okay, I'm gonna stop keeping you in suspense. 2 and 4, interesting. So actually, it's cab drivers. These quotes are from cab drivers working for Uber and Lyft. So the few of you who said number 5 were correct. And you might be like, where did you get this information, Mattia? This is really interesting. So this came from a book called Trust Fall. It's written by Sarah Mosseri, who is a sociologist, and she talks about how workplace relationships are not supporting people's needs right now. So if you've been in the field a while, which a lot of you have, and you're like, okay, but why is everything terrible now? You may want to read this book. Although it is fairly academic, I found it to be incredibly interesting. And when I learned about it, I was very excited that I was able to get it from my local library. So the main factors that she talks about in Trust Fall for what led to things getting this way are the following: destruction of the social safety net, rise of corporate power, decline of unions, and lack of legal and institutional support. Now, I'm betting most of you work as therapists just given the context of this presentation, but I've never been in a union, and I think most of the time therapists are not eligible to be in unions. I've heard of Kaiser Permanente out in California having unions, but I think that's pretty rare. And we can fix this. These are systemic problems, but they don't have to be this way. And the antidotes to the bad problems that people are experiencing right now with work are the following: having a robust social safety net that protects people, including things like universal basic income, labor organizing, including unions, stronger employment protections and standards, living wage, not just minimum wage, and community connections. Because one of the factors that Sarah Mosseri highlighted in the book is that when people don't have strong community relationships, they are more reliant on work to meet their social needs. And so people often end up staying in work situations that really aren't suiting them because they need social connections. Because again, if we go back to Maslow, we need social relationships. Okay. In an ideal world, our workplaces would give us the following: a living wage in safe working conditions, the opportunity for workers to achieve satisfaction, happiness, and support for a meaningful life. Burnout and other problems at work are a social phenomenon. They're not an individual failing. When the relationship between workers and workplaces is good, workers will thrive and workplaces will be successful. So if we take a holistic approach, we want to think about what we can do on an individual level, what we can do on an organizational level, and what we can do on a community level to create what we need for well-being. And because this spells things out from the solidarity, is approach, I am just going to let you read that on your own. But essentially, we need policies and we need structures that support health and not just burnout. There are different reasons that we might have a good or bad experience with work, and there are psychological factors. So psychological safety, fairness, meaning, and positive emotions that can influence the experiences we have at work. Psychological safety is about the desire to be free of anxiety in contexts that may pose social risks. And when this is addressed at work, it may include setting up policies and procedures to help protect people from the harmful dynamics that could damage trust and teamwork. So things like cliques or favoritism, stuff like that. Fairness is about wanting to be treated with respect and dignity and knowing that the decisions that affect your life are made in a way that is free from bias or discrimination. On the group level, we can connect this to social justice. Meaning, this is about our wish to do things that are valuable, which creates a sense of purpose for you ASWB fans. And meaning is also associated with self-actualization and personal growth. Positive emotions. Sometimes we experience these at work, even when work isn't going well. So when we're experiencing pleasant feelings, this is a good thing because it could be the case that positive emotions like hope and efficacy and resilience and optimism and more are resources that we can use to get things done and to help us feel good. When we're experiencing positive emotions, it's related to our sense of well-being and positive outcomes at work, in addition to being related to a good job person fit. Community. Our workplaces are socially constructed, and the quality of the relationships we have at work is important. We experience a sense of belonging when other people act in ways that promote inclusivity and support. So those of you who said, my supervisor listens to me, my supervisor supports me, I like the people I work with, you're experiencing belonging in your work. Positive workplace culture includes civility and kindness in our words and our actions. And when we feel social support and community, we can seek out help and receive help when we need it and offer that to others. Our work experience is along 3 dimensions. We can think of each of them as our own spectrum for each factor. Individual effort from exhaustion to energized. Social context, anywhere from cynicism towards the rest of the organization to close involvement with colleagues. Self-evaluation could be anywhere from feeling a sense of shame about professional inefficacy to feeling a sense of successful accomplishment. All right, challenges in supervision. I am not going to read all of the principles of cultural competency because you can read them on your own, but essentially we have these guiding principles that help us think about what it means to be acting in a way that is culturally appropriate and culturally competent. Whether that is our beliefs, our actions, the systems that we're in, and offering things that are appropriate and culturally appropriate to our clients and the people we serve and the systems around us. Somebody had asked about age and how that affects supervisory relationship. Age and race and gender and class and culture and level of education and socioeconomic status and power and health and all sorts of other factors can impact our supervisory relationships just like they can impact our clinical work and our other relationships. So we never want to be thinking about our supervisory relationships as not having interaction with our identities, either as a supervisor or as a supervisee. Some of you may be familiar with the power and control wheel, especially if you've done some work on domestic violence. These problems could show up in supervision in a variety of different ways, things like ignoring supervisees, canceling supervision, especially if that's happening repeatedly, dividing up clients, projects, or responsibilities in a way that's unfair or inequitable, defensiveness, minimizing, denying, or blaming, controlling behavior, threats, and even contempt. On the other hand, we really want to have relationships that are characterized by equality. And so in our supervision relationships, it could include transparency, respect, honesty, justice, fairness, trust, accountability, and responsibility. I'm going to skip this slide for questions and save all the questions for the end. Hope that's okay. If you need to write it down for yourself, please do that. You have all asked such great questions so far. I don't want to miss out on answering your questions. All right. I had a lot of fun with this because these are mostly based in my own experiences. Handling ethical dilemmas. General principles of dealing with ethical dilemmas. When in doubt, consult. Whenever possible, allow yourself the time and space you need to reflect before making a decision. Look to your profession's code of ethics. If you're confused, it might have some guidance that will help you. And if not, it might help point you in a useful direction. Consult with a supervisor or colleague you trust. If you need to, you can contact your malpractice insurance for guidance. And do take care of yourself because ethical dilemmas are inherently complicated and frequently unclear. All right, examples. First example, you are performing an evaluation in a community mental health center and a child discloses abuse or neglect that was not previously reported to your supervisor, but not to you. The supervisor insists that you must file the report of suspected abuse or neglect. What would you do? I'm going to open up the chat and see what you all think. If you could share this briefly, that would be great. Okay, so I see a lot of people saying report, 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 report. All right, the supervisor should report. You can assist. Report and document that the supervisor asked me to report. Report, report, report. Okay, so there's a lot of agreement among all of you. And you are on the right track for sure. So so the real life answer is this was happening a lot in one of my prior jobs. Note that I said prior, it's not a current job. I didn't feel safe enough to ask my supervisor to stop doing this, so I just filed the reports. I did consult with colleagues who said that this was happening to them too. Also, fun fact, in this specific organization, there was one instance where my supervisor insisted that I file a report of suspected abuse or neglect, even though the child and family told me that those allegations of abuse and neglect had already been reported to Children and Youth Services, and there was already a caseworker involved. As you might have guessed, there are a lot of reasons I don't work there anymore, thankfully. All right, next. Example number 2. You ask your supervisor whether you can take on additional responsibilities that other people in your department have. Your supervisor says no, but doesn't offer you any feedback or information about how you could grow or improve in your role to be eligible for these additional responsibilities. What do you do? Okay, I am catching up to you. I see ask, quit. Seek a mentor who's not the supervisor, ask for feedback, ask for that feedback and supervision, find another job. I see someone else's team quit. LOL, nothing. Ask for more information, clarification, and feedback. Get a new supervisor. Ask if they can tell me why. Ask for more feedback. Oh, these are great. I love these. Ask more. Inquire more. Ask for specifics, ask what you can do to become eligible. Ooh, document it and keep for annual review. Yes, ask what I could do to get to the place where I could take on additional responsibility. These are very, very good answers. And yeah, request a meeting, ask why. Great. Okay. I am with the people who said vote with your feet and leave. I decided that I wasn't ever going to get what I wanted or needed at this job. So I accepted another part-time job and worked at both of them until I was ready to leave the first one. Also, the other part-time job was the one from example number 1. Fun story. I am big on quitting bad jobs when it's possible to do that. All right, example number 3. You're on vacation for a week, and while you're away, the department receives information that the grant funding has been cut and they need to eliminate a position. When you come back from vacation, your supervisor brings you into a meeting with HR and tells you that you're being laid off and that she already told the rest of the department. What do you do? Wow, seek legal advice. Cry, pack up your things. I did not cry, but I was upset. Yeah, collect unemployment, sue, be a man and move on. Ooh, that's interesting. Seek legal advice, crash out, leave, seek internal position, file grievance, contact EEOC. These are really interesting. Nothing right to work state, yeah. Seek legal advice. I didn't actually do that, but that's a good idea. Apply for unemployment and look for a new job. Be thankful you were done there. Cash out PTO and run, get an accurate referral. All right. Um, you all are so enthusiastic about this. I love this. Okay, I'm gonna read a couple more comments and then I'll tell you what I did. Um, Celebrate, that means better things are coming, Nikki, my hero. Move on. Oh, Denise, I'm sorry. Um, yeah. Um, ask for severance. Code of ethics. Yeah. Okay. Um, I knew there was a possibility that I would be laid off or that someone else in the department would be laid off if the grant funding wasn't continued. But I changed my opinion of my supervisor because she told everyone else first before she told me. Again, I was only away for a week. There was no reason for that. However, I never had enough work at that job anyway, so it wasn't really a total surprise that the funding wasn't continued. All right. Uh, Example number 4. You are a supervisor managing a student intern and you're concerned about your intern's performance. They're not meeting your expectations and they're not responsive to your feedback. Even though you've consistently talked with your supervisor about how to address these problems and implemented changes, the student's performance hasn't improved. What do you do? Consider a joint meeting with the school, contact the school, speak with the student's field liaison, talk to the field director, keep asking for help, review concerns, um, reach out for a meeting. Um, okay, contact field liaison. Yes, okay, so get transparent with the student about the concerns and real consequences. Yes, okay, great. You all are clearly really on point with this one. I can't even keep up with you because you have so many great things to say. So we're gonna stop with that one because you already have shared lots of ideas. Um, in this specific situation, I worked with my supervisor and the field liaison to make a plan for this student. We ended up recommending that the student complete the field placement elsewhere as we didn't think it was possible for them to improve performance to the level we needed. So you all are spot on and in alignment with me in 2018. Great. Yeah, these are really good comments. Thank you. I'm very curious to see what you have to say about the next one, which is, here we go. Example number 5. You're considering accepting a new job at a private practice, but there are some aspects of the contract that seem suspicious to you, like the fee split, restrictions on outside employment, W-2 versus 1099 employment, the construction in terms of remote, hybrid, or on-site, expectations for how many hours you're supposed to work, framing for paid time off, etc. What do you do? Okay. Um, I really like what you said about the interns. You all have great things. Don't join practice or do not sign that contract. Ask questions. Do not take the job. Get clarification. Move on. Seek opportunity elsewhere. Move on. Communicate. Decline it. Don't sign the contract and leave. Meeting. If you can't agree to the contract, move on. Ask for clarification. Yes, yes. Discuss and make sure you're comfortable before signing it. Anything, renegotiate or don't sign up. Ask all your questions before accepting. Yes. Ask for clarifying questions. Okay, you all are really on fire today. Don't accept the job. Don't take the job. Don't take the job. Great. I can't even keep up with how fast you all are, which I think is very fun. So this one is not just one situation. This is the one that's a composite. Like I said, this is not just one situation. In one of my job searches, I ended up withdrawing from a lot of positions that I was under consideration for because they were shady. And how you decide a situation like this is going to be specific to you and what you need, but I encourage you to think about the following. Your financial situation. Is your family income or your household income shared with a spouse or partner? Is your household just you? Are you the primary breadwinner? So what's your financial situation? What's your capacity emotionally and energetically? What's the number of hours you can work in a given day and in a given week? And do great work, ideally. What's normative in your area? What's sustainable and realistic for you? I do not advocate accepting shady employment, sketchy employment, or substandard wages if you are in a position to turn down the offer. If it's take this job or you can't pay your bills, like you can't eat or you can't pay your rent or mortgage, that's different. But if you're able to turn it down and tell them why. Other ethical issues in supervision, there are all sorts of shady things going on, and some of these are from my experience, and others are things I saw or heard about. Religious discrimination, favoritism, taking work away from contractors to give to unpaid interns because the interns were not paid, discrimination based on family status, or even discrimination in terms of not returning clients to their original therapist after somebody was out on parental leave, misrepresenting the job during the hiring process. Okay, in the interest of making sure that I get to questions that you have, I'm going to breeze through some of this too, but know that that is not saying that it's not important. It's just that you all have been so great that I want to make sure that if you have questions that I can help with in our limited time today, that we do get to them. All right. We can't make everything better, but we can make some things better. And making work better starts with all of us saying no when things are unacceptable. We can't always avoid the problems that exist at work, but we can sometimes mitigate and minimize issues. So I'm proposing that we use a traffic light system for this section of the presentation. We have red, yellow, green is more info needed, red is stop, yellow is caution, and green is go. It's really hard to screen for cultural factors at work, whether you're a job seeker or a hiring manager. So just be aware of what cues you're giving or what cues you're seeing. We don't have control over everything, but when we're looking for jobs, we have control over asking good questions, checking in about progress when we are at a job or when we're hoping to be considered for a job. And we also have control over getting a reality check. If you have friends and family and colleagues who have good judgment, talk with them in a way that's appropriate and doesn't violate confidentiality or anything like that, but talk with other people. Know what works for you and what doesn't. Think about your needs and your priorities. Healthy workplaces are going to offer us fairness, respect, integrity, transparency, and honesty in how they conduct themselves. Think about what it might be like to work somewhere. Is this a workplace where the hours they give you are consistent, or are they unpredictable? Do you have good administrative support or lack of support or unhelpful support? How is work assigned? How are clients assigned? What do things look like when it comes to hiring? Is there a problem with overhiring, which is more common in fee-for-service jobs, or underhiring? This is more common with salaried work, certain nonprofits, and even community mental health centers and other under-resourced organizations. How does this workplace measure progress? Do you get regular feedback? Do you set and review goals regularly? Is this a workplace that has healthy boundaries? Are they treating you with respect and treating others with respect when it comes to sharing personal information appropriately? Are they respecting privacy? Okay, what is it actually like to work here? Because a lot of employers don't represent things accurately. And that's not necessarily that someone's intentionally trying to mislead you. If you can, when you're interviewing, try to talk with peers rather than just your supervisor, if that's an option for you. One resource that I highly recommend is the workplace advice column, Ask a Manager, which has advice on tons of topics from interviewing, negotiating salary, negotiating raises, advice about your boss, advice about your coworkers, so much more. This is a roundup on job searching in case this presentation is making anyone rethink their life choices. I mean, their current jobs. Workplace relationships could be exploitative or respectful, depending on how things are structured. So exploitative relationships have unfair splits, especially in private practice, overscheduling, excessive demands and unrealistic productivity expectations, non-compete agreements. excessive notice, and unsustainable compensation practices versus respectful relationships that have fair splits, especially in private practice, scheduling based on what actually makes sense and is reasonable, appropriate and achievable productivity expectations, and fair contracts and employment policies. Beware. Due to increased availability of telehealth, a lot of new companies have come into existence in the past few years. And while some of them are fine and some of them are maybe even great, a lot of them are doing all kinds of shady stuff, especially if they're owned by tech companies or insurance companies and not therapists or healthcare professionals. When I say shady stuff, I mean really shady stuff. There have been multiple class action lawsuits against these big therapy tech companies due to privacy violations regarding protected health information. And there's evidence that some of these companies are using clinical information to train AI and create AI chatbots and AI therapists. In addition, these big therapy tech companies are owned by insurance companies, and they're frequently offering higher reimbursement rates to therapists who go through them than the rates that they could get on their own if they credentialed independently. The tactics these companies are using are straight out of the usual venture capital playbook. Make an appealing offer initially, change the terms and cut pay and benefits. Remember the taxi drivers? Yeah, when they worked with Uber and Lyft, it looked good and then it wasn't. These companies are focused on profit. They're not companies that care about therapists having a good work experience or helping clients have great outcomes. Just in the past few weeks, there's been some news about this regarding changes to reimbursement rates. So somebody commented about this in the chat earlier, and you are right, that is happening right now. It also can be harder to research fully remote jobs and companies in a way that is accurate versus companies based in your local community. Please, please, please do your own research before you decide where to work and who to work with. You worked hard for your license, and I want you to continue to have it and not be in trouble because the company you're working for is doing things that are unethical or inappropriate. Contractor versus employee. I'm going to go over this briefly, but if you want to learn more about it, there is more to learn. Obviously, I'm not a lawyer, so I can't give legal advice about this, but I'm just going to tell you a few things. Number one, misclassification is a big problem in the field. When I was starting out, there were several jobs that I had that were independent contractor jobs rather than employee jobs, and I didn't really think that it was legal, but I didn't have any way to do anything about it. Misclassification has different legal implications for taxes. If you are an employee, your employer pays your taxes every time you are paid, versus if you're an independent contractor, you are responsible for paying taxes, usually quarterly, estimated federal and state and local taxes. If you're an employee, you can be eligible for benefits, but not if you're an independent contractor. And if you are hired as an employee, your employer has more control over your work versus if you're an independent contractor where they don't have as much authority to direct you. What does the IRS say? There are some changes in legislation that are relatively recent, and I will get into that on the next slide. A new federal law went into effect in 2024. Businesses cannot hire contractors to do the primary work of the business. For example, in my private practice, I could hire an accountant or a lawyer on a contract basis. I cannot hire another therapist as a contractor since the primary function of my business is to provide therapy. Is anyone surprised about that? This is a new law. It is a federal law, so it applies to everybody in the US. Someone who is not independently licensed is not allowed to be hired as a contractor in most circumstances because of the issue of oversight and direction. There are three different factors that the IRS considers in thinking about who can be hired as a contractor versus an employee: behavioral control, financial control, and the type of relationship. You can take a look at the IRS website on this later if you're interested, but essentially it's about how much control and independence does the worker have in these domains. businesses need to consider all of these factors when evaluating whether a worker is an employee or an independent contractor. Some factors might show that the worker is an employee, while other factors indicate that the worker is an independent contractor. There isn't a magic or set number of factors that make somebody one versus the other, and there isn't only one factor involved in making the determination. Also, factors relevant to one situation might not be relevant in another. So you need to look at the whole relationship and consider the extent of the right to direct and control the worker. And smart businesses are going to document those too. All right, this is it. Final questions. Okay, I'm still scrolling through you saying hash out the contract and do not sign. Yeah, it's yes, interns are not allowed to work as a contractor. What is a fair split in private practice? If you want to know about that, I think that it is a really good question because I think it varies practice to practice what the split is going to be. I would say less than 50-50 is not fair in my opinion. I've heard about different splits, but I think what I would say is fair is like between 50-50 or even 55-45 all the way up to like 65-35. I think that it's sometimes not represented clearly, especially with insurance-based practices versus private pay practices. But Kara, that's an excellent question. Oh my goodness, Tara, thank you. Those last slides were mind-blowingly helpful. So glad to learn about this new law. I might actually return to the field. So if the issues around interns, ALCs not being contractors, does that mean they cannot have their own practice? That's going to vary state by state, Julie. I can't answer that. Am I unable to share the names of the unethical online therapy companies, Kathleen? I would be all too happy to share that, yes. But if you want to learn more about this, I strongly recommend a webinar from the company Zinini. I'm going to put that in the chat and then webinars. I am going to tell you, you may have heard of them. They are things like Rula, Grow, Talkspace, Alma, Headway, BetterHelp, Talkspace. There are tons of them, and these companies did not exist a few years ago. And yeah, I wouldn't have considered that the company is training chatbots either. So these companies are hiring therapists as independent contractors, which is not legal given the federal law, and they are treating people like independent contractors, even though they're running their own businesses and not getting any benefit from working for the companies in the way that they would get a benefit from working at an employer where they got to have relationships with coworkers and collegiality and things like that. Yeah, there are so many things going on right now. I feel like I'm reasonably informed, and I'm sure that there are things going on that I'm not aware of. What makes these companies unethical, Chastity? That is a good question. They are doing things that are not honest, and they are also owned by the insurance companies. I realize I should have maybe led with that. So these companies are creating what's called vertical integration, which is sort of like a monopoly where you own every piece of the puzzle. So let's imagine that I, for some reason, own a factory and my factory produces paint. So I own the pigments, I own the cans, I own the machines that are processing things, I own the trucks that are sending my paint out into the world. Does that help? KJ's iPhone, that sounds not great. And I am concerned about that, but I don't know about Utah specifically. Sarah Melton, I'm not saying it is inherently unethical to work for Headway and Alma, but what I'm saying is read the fine print and know that these companies are doing things that are not ethical, and that it might be on you if unethical things happen. Okay, close to a monopoly. Nikki, I can't tell you that exactly, but I am just going to say do your research. Are there suggestions for AI tools to assist with supervision? I really can't speak to that, Lisa, but ask around and I'm sure someone would like to help you with that. Um, Other questions? Don't we need to be licensed in the state we're providing services for? Yes, you do. Are there other questions? I have a few last things that I want to cover, and I want to make sure that we end on time and also that we get to hear from Bonnie about upcoming things with Agents of Change. You're welcome, everybody. Yes, they are widely advertised. Is there training to be a supervisor? Yes, there are trainings to be a supervisor. Ask colleagues with your same license in your state. Um, yes, the new law regarding contractors covers all 50 states. It's federal. Do I know the status of being able to work in various states? That's going to depend on your discipline. The counseling compact is farther ahead than the social work compact, SciPact. The interstate compact for psychologists has been in effect in a few years, or for a few years. Marriage and family therapists don't have an interstate compact yet. Okay. Any last questions before I take a couple of minutes to show the last few slides and we wrap up? Going once, going twice. Well, if you were late, you'll get the recording, so that's okay. Yeah, exactly. That's from the Department of Labor. Thank you for saying this has been excellent. All right. So if you, like me, are a big reader, you may enjoy reading some of these books. Burnout by twins Emily and Amelia Nagoski is about stress and how there are different things that we need to do to deal with our stress, but that we need to be thoughtful about the strategies that we use because just problem solving doesn't deal with the fact that stress is a real reaction that happens in our bodies. Rest is Resistance is about how we need sleep and we need rest, and capitalism is burning everybody out and acting like that's normal. Therapist Burnout from Kelly Higdon and Miranda Palmer is if you are running a private practice or want to and want to make sure that it's sustainable, it's excellent. They also run the company Zinimi that I had recommended earlier if you're looking for free webinars to help with being able to build a private practice or sustain a private practice. Work Won't Love You Back, kind of similar to some of what is in Rest is Resistance and Burnout, that if we are so focused on our jobs, it can impact the rest of our lives in ways that are unhealthy. Can't Even and Helen Peterson's book about burnout is also really great. I love her newsletter, Culture Study. It's one of the first things that I open whenever I see it in my inbox. Age of Overwhelm and Trauma Stewardship are by Laura Vander-Lipsky, who is a clinical social worker based in Washington State. Trauma Stewardship, very excitingly, is celebrating its 20th anniversary, and the 20th anniversary edition is coming out later this year. I'm looking forward to pre-ordering it. I love that book, and it's on the bookshelf behind me. Having It All by Dr. Corinne Lowe. If you like data and want to use data to improve your life, then I recommend that book a lot. I'm not going to go through my references, but hopefully this covers some of the things that you were curious about, whether it's where can I find the code of ethics or what articles were you citing. Lots and lots of resources that I hope will help you learn and do great things. The Solomon article is the attachment and supervision article. So if you just want to read one article, please read that. I have been blown away by it since I first learned about it. Book, the Why I Left the Network. I don't have real citations for this, but I repurposed some information from other presentations that I've given. The multicultural issues in therapy presentation was with Agents of Change. So if you liked this and you want to learn from me more, then that and two other presentations about military children and families are available. Thank you so much. You have been so great. And I was so delighted about how engaged all of you were today. If you have other questions or you're like, hey, Mattia, you seem fun. I want to get to know you better. Please feel free to email me. This is my brand new, as of a couple months ago, email address as I am getting ready to open my own practice, mattia.lewitt@philadelphiasocialwork.com. Also, as of this week, I launched my website, so you can check that out. Thank you, Bonnie, for all of the party hats. Bonnie and Megan Mitchell, who also is involved with Agents of Change, know that I've been really busy trying to get things up and running with my practice, and now my website is live, and you can check it out at philadelphiasocialwork.com. And if you have feedback, I would love to hear about it because it's new and I made it myself. I want to see what everybody said in the chat. I'm going to stop the share and turn things back over to Bonnie.
I hope you enjoyed this continuing education course from Agents of Change. Want to earn your CE credits for this course? Visit agentsofchangetraining.com or the link in the description to purchase the course and take the post-test. If you're looking for more CEs, check out our unlimited plan. You will get unlimited access to 150 plus ASWB and NBCC approved continuing education courses for one low annual fee. We're always adding new courses. Did I mention we also have 5 free CE credits available too? Check it out at agentsofchangetraining.com.